July is Sarcoma Awareness Month, a time to bring attention to this specific group of rare cancers. This is Dr. Tamara Floyd. She is a surgical oncologist with OSF Healthcare who treats many of these kinds of cancers. Good morning, doctor.
Good morning.
Now, first off, what is a sarcoma and how is it different from a regular cancer?
That's a great question. So a sarcoma is a rare type of cancer, and what makes it different from other types of cancer is that sarcomas develop from a variety of different connective tissues, which include not only bone, cartilage, muscle, and also blood vessels and fatty tissues. So any of those cell types or connective tissue types can develop into cancers, which would be sarcomas.
I see, and that's opposed to, say, a cancer of the bone or the skin, stuff, or an organ.
Correct.
I see. And so how aggressive are most sarcomas? What sets them apart? What's the usual form of treatment for that?
Yeah, so for sarcomas, the typical type of treatment for sarcomas does usually involve surgery as an important component to treatment of sarcomas. And for the other thing for sarcomas, the other treatment that's often involved is radiation, and that's either given before surgery or after surgery, again, depending on the type of sarcoma.
Now, what care options does OSF offer, and OSF Cancer specifically for sarcoma?
Yeah, so OSF Healthcare, especially now with the Cancer Institute, does offer with surgery, surgeons such as myself, as well as we have radiation oncologists that will provide the radiation treatment for patients with sarcomas. Additionally, we work very closely with Illinois Cancer Care and its medical oncologists in treating patients with sarcoma.
Are there any known risk factors for picking up sarcoma during your life, or any signs that people should look out for?
Oh, great questions. So with sarcomas, there are not a whole lot of known risk factors. However, some infections, including some viral infections as well as some parasite infections, may increase a person's chance or likelihood of eventually developing a sarcoma. Additionally, some environmental exposures such as radiation can also increase a person's risk of developing a sarcoma in the future. There are also some genetic syndromes, meaning gene mutations that run in families, that may also predispose a person to developing types of sarcomas.
All right, and of course, what should someone know if they are trying to find out if they are at risk?
Yeah, so certain things to look out for is if you have a tumor, a lump, or a mass, and there's something about it that's changing, meaning either increasing in size, becoming more uncomfortable, or causing more pain, so certainly would warrant being evaluated for that. And if someone has a question or wants to reach out to OSF Cancer Support Services, they can reach out by phone at 844-OSF-4-HOPE. And that's a way to contact OSF Cancer Support Services.
All right. Thank you so much for joining us today, Dr. Floyd. And
Absolutely.
We will be back with our next half hour after the break. Another half hour of 25 News Good Morning is coming up next.